Hello, and a warm welcome to our viewers and our listeners. I'm Mara Kronenfeld, Executive Director of UNRWA USA, and I'm grateful that you've joined for another episode of Let's Talk UNRWA, which is our quarterly live stream speaker series offering an exclusive look at UNRWA's work and the people who make it possible. This series gives a unique opportunity to hear directly from UNRWA staff and leaders, many of whom are refugees themselves. And for those of you new to the United Nations Relief and Works Agency for Palestine Refugees, UNRWA has been serving the needs of Palestine refugees for 75 years, not only in Gaza Strip and the occupied West Bank, including East Jerusalem, but also in Syria, Jordan, and Lebanon, where the needs are just as important. At UNRWA USA, we support UNRWA programs across its 5 fields of operation, from healthcare to education to food assistance and psychosocial support. Before we begin, I want to make one thing absolutely clear to all of our listeners, especially with the misinformation and confusion circulating online. UNRWA is still in Gaza. UNRWA never left. The UN agency's teams, almost 12,000 individuals, continue to provide life-saving primary health care to 15,000 people a day on average, sanitation services that help prevent diseases. UNRWA clears almost 320 tons of waste daily. That's almost 747 and a half. The maintenance of water wells to ensure clean access water to 40% of the population. Education to increasing numbers of children going back to school after 2 years of missing out on education, mental health support for hundreds of thousands, and shelter for hundreds of thousands of people, and doing everything they possibly can to keep people alive and provide them with some modicum of hope in these extremely difficult and challenging times. Today's episode is especially important because we'll be taking you inside the current health system, and can't even call it a system, the health situation in Gaza, where UNRWA's medical teams continue to deliver life-saving care under truly unimaginable and impossible conditions and with severe shortage of medical supplies. I'm so honored to be joined today by a remarkable guest, a leader who guides this work in Gaza every single day while she's currently in Amman, Dr. Ghada Al Jadba, Chief of UNRWA's Health Program in Gaza. And we're hoping Dr. Akihiro Seita, UNRWA's Director of Health overall, will be able to join us, but he had a last-minute meeting, so if he comes on, we'll be so happy to have him help Dr. Ghada answer these questions. Both Dr. Ghada and Dr. Seita are at the very center of UNRWA's medical response, leading teams who work around the clock to help keep a devastated healthcare system functioning. So I'm going to tell you a little bit about Dr. Ghada Al Jadba first, and I will also share Dr. Seita's bio in case he's able to join us today. I had the opportunity to meet Dr. Ghada in person in Gaza in 2022, and that meeting had a profound effect on me. Dr. Ghada is not only obviously an amazing professional doctor, humanitarian, but also a very strong and powerful messenger for Palestinians in Gaza. And I can't be honestly more honored that I had the chance to meet her in Gaza in 2022 and get to know her just a little. I'm so pleased to have this conversation today. Dr. Ghada Al Jadba has served Palestine refugees in Gaza for over 2 decades as chief of the healthcare program there. She oversees UNRWA's primary healthcare network, emergency medical operations, disease prevention, maternal and child health, and clinical services for hundreds of thousands of patients. Of course, this is all before what experts know to be a genocide in Gaza, and then ongoing work during the last 2 years of atrocities. Her leadership has been critical in navigating, of course, one of the world's most challenging humanitarian health environments over the last 2 years. And Dr. Seita is UNRWA's Director of Health across all of the field sites and a leading global expert in public health and refugee health systems. He has guided UNRWA's health services for over a decade, developing integrated approaches to chronic disease management, public health surveillance, and emergency medical response. across all 5 fields of UNRWA's operations. So at this time, I'd like to welcome Dr. Ghada Al Jadba. Wonderful to have you here with us, albeit we wish these were better times. And as I mentioned, Dr. Ghada is coming to us from Amman, Jordan. And luckily, we are so happy to have her here safe and as well as possible, given the conditions we are all seeing happening and play out every day in Gaza. So welcome, Dr. Ghada. And maybe we can start with just you sharing the overall situation in Gaza, the scale of the crisis, just in your own words from what you know. And this is really for some of the individuals watching who may be less familiar with the situation, particularly the situation of the medical and healthcare sector in Gaza. And maybe you can give us a sense of what a day in the life of a healthcare worker in Gaza looks like right now.
Thank you, Mara, and thank you for this introduction. It was really also my honor to meet you in Gaza in 2022. Yes, this is the time
summer of 2022. Yes,
2022. So this year is really I consider it the year just before the war. So you visited us while Gaza was still present. And this is what I can say, this is like the wonderful dream for us. Like when we think about Gaza before 7th of October 2023, when there was a Gaza, when there was humanity in Gaza, a little bit, because we were suffering all of the time. For the kids, by the way, we were suffering from the occupation. For the more than 7 decades, we were suffering from the blockade since 2007. We were suffering from repeated escalations, but it is not comparable to the last war. We were suffering. We were suffering from siege, from a lot of disasters every time, and then, but at least still there was Gaza. But simply I can't describe what is now in Gaza. There is no Gaza now. There is no. They destroyed everything in Gaza, but it is in buildings. But I can assure you, they are still the Gazans. They are still the people in Gaza. But for me, as a chief health program, with the team, with more than 1,000 health staff, we built a lot. We built a lot, and I am really sad when I say that everything was destroyed. I am talking about Gaza physically, and there is no Gaza physically, but the people is still in Gaza, and all of what we have been physically in Gaza were destroyed. The beautiful health centers. We used to have very beautiful health centers, and I am proud of that. I was part in the design of these health centers, and we wanted to have these modernized health centers to Palestinian refugees. We lost all of that, but still we have the people in Gaza, the kind people of Gaza, the people of Gaza who suffered from all of this unhuman situation for the kids, and still we have health staff and UNRWA staff who suffered a lot, all of the kids, but more and more and more in the last 2 years. Simply Gaza, like huge destruction. Everything is destroyed in Gaza. The buildings, the health facilities, the hospitals, the health centers. We lost the medical stores. We lost the medical supplies. We lost homes, our homes. Like my home was destroyed in the 2nd day of the war. And then followed by the homes of all of my friends, my family, my relatives. You can imagine that. And you can imagine like the people, they were displaced 1 time and 2 times, and every time they were feeling that this is the last time of displacement, but they discovered that no, there is a 3rd time and 4th time. Some people, they displaced 10 times and more. And when we are talking about displacement, it is not only physically movement, like we would move from this place and another place. No, we are moving from our homes first of all, leaving everything, and leaving part of ourselves. And then we started to leave another part of ourselves, another part of ourselves. And this is the description of one of my friends. She described that to me. I started to leave every part of me until I felt that I left all of everything of me. I don't feel I am a human. I feel that I am a ghost. This is her description when she was displaced in Gaza. She is a health staff in the health management more than 8 times. She was in Rafah, and she was describing this tough journey. And by the way, she was working. She was every time from different places where she has nothing. She was like waking up in the morning and go to the health center or go to the nearest medical point with which we are establishing, replacing the health centers which are either damaged or inaccessible to us. We replaced rapidly them by medical points in UNRWA shelters, in Mawasi area where a lot of people, they were displaced in the western part in Gaza. We were going where the displaced persons go and establish medical bonds, very primitive medical bonds, but still we are available. And we continue to provide the services to the Palestinian refugees with the complete collapse of the public health system in Gaza, with destruction of the health facilities, and losing the medical equipment and the medical supplies is still there. We continue to provide the services with different health partners, but UNRWA continue to be the main health provider in terms of primary healthcare services. It is well known by the community. The community trusts UNRWA, connected to UNRWA, and they cannot imagine Gaza without UNRWA. This is the lifeline in Gaza. And yes, as you mentioned exactly, Mara, we haven't stopped working in Gaza even a single day. Since 7th October, we absorbed different shocks. We absorbed like the shocks of losing major health centers, of displacement of like hundreds of thousands of people in Gaza, including our health staff, losing the connection in the first, but we try to connect them and to try to like to distribute them here and here and here. But it is like, I can't describe the situation. It is like the end of the world. One time, Dr. Seita is here. Dr. Seita, I hope that Dr. Seita is here, but he is involved in other meetings. Dr. Seita visited Gaza different times during the war. And the first time I asked him, what is the situation? He said to me, it is like end of the war. The second time I asked him, it was much difficult. Every time is more difficult. I asked him, what is the situation? This is like end of the war again. He said to me, no, this is beyond end of the war. So I don't know what is beyond end of the war. So it is the hell. I said that to him. He said to me, even worse than the hell. So I cannot describe what is happening in Gaza or what is the situation is in Gaza beyond that. This is beyond the hell. And you can imagine everything. By the way, before 27 October 2023, we used to have reasonable good health system, either the public or in UNRWA. I was proud of the UNRWA healthcare system with wonderful indicators. We built a lot of things, but since 7th of October, there was continuous destruction and destroying all of these beautiful things and all of our efforts. But by the way, we never quit and we never fed up. We continue to provide the services as much as we could every day and according to the needs of the Palestinian refugees and non-refugees also in Gaza.
Yes, and there, my understanding, and correct me if I'm wrong, that there still, even to this day, are some 4,000 individuals in the healthcare services for UNRWA, between doctors, nurses, healthcare workers, healthcare administrators, and a couple of questions about them. One is, as you said, these are individuals who are facing the very same conditions that the patients they're treating are. So they have faced starvation at various times through the last 2 years. They have had their own family members injured and killed, and they have shown up to work every day under the most hazardous, difficult, painful of conditions. Maybe you can tell us about any of your colleagues, what their life is like, how they continue to persevere under the most difficult settings, and then also share with us the kind of, you said primary healthcare. I know UNRWA has primarily been engaged in primary healthcare. What are the services? What are the medicines, when available, that they were able to provide? How did they help the population going through trauma that few of us can imagine?
Okay, for the number of health staff who are available in Gaza, UNRWA health staff, by the way, this number may be UNRWA health staff among the 5 fields, but in UNRWA, we used to have 1,300 health staff who are still available in Gaza, providing the basic primary healthcare services in all of Gaza Strip. And as I mentioned, and I confirm again, we have never stopped providing the health services in Gaza, despite of all of the huge devastating situation and there in Gaza and destruction. So more than 1,300 health staff. The suffering of the health staff, like as you mentioned, Mara, those health staff, they are like part of the whole population in Gaza. So they were subjected to killing. Like we lost considerable number of UNRWA staff, including our health staff and my friends. The first one we lost, I remember it was in the first week of the war. She was an amazing doctor, gynecologist. She was my friend, my close friend. She has 2 beautiful daughters and she left them. She was amazing. I remember her smile all of the time and how much she was kind to the pregnant ladies. So this is the first shock to me, and then we continued to have different shocks with losing our friends, our colleagues, and also the staff, they were subjected to lose their family members, and as I mentioned, losing their homes, losing their feeling of safety and their feeling of humanity, and the displacement. This displacement was very difficult to all of the people in Gaza, including the health staff. One of them, she described that to me, it is like, we call it in Arabic nuzuh. And like she mentioned to me, this is like tulu' al-ruh. It is like taking the spirit, like, or the souls, something like that. So it is difficult. It is difficult, very difficult. And one of the colleagues, he mentioned to me, I prefer to be killed with my family and not to be displaced again. I cannot be displaced again. This is very difficult to me. So they were subjected to all of that. In addition to the hunger, in most of the times in the world, the colleagues include, like part of the people in Gaza, they were subjected to the famine in Gaza, to hunger. They were not finding the food to them and to their family. And many of them, they were saying to me, we reserve the food to my children. I don't eat like enough, very, very few amount of food, because I prefer to make my children like it, provide my children with this food. And I know that many of them, they were exhausted by the end of the day, and they couldn't complete the work, especially like physiotherapists, because they are doing this manual work. They were not able to continue working because simply they were hungry. Like, in addition to being not in their homes, maybe most of them in tents, manually even made, not like good performed tents, subjected to bombing all of the time, killing. And do you know, and also going to the health centers or medical bonds, walking, either in hot weather or in cold weather. They were hungry, and they were not finding food to them or to their children. This was maybe the most painful to me when I was talking to my friends, and they mentioned to me, we are hungry. And some of them, I were not like recognizing them when I see them, because they lost to 20 kilogram, or some of them more even than 20 kilogram. This is the situation, but like miracles, they continue working. We continue working, even in the darkest times, the very dark times, in huge military escalations, or in like a huge siege with no food enter Gaza. We continued, and we have the reports, and anyone can look to the health cluster report. We continue to provide not less than 12,000 consultations, around 12,000 consultations every day. These are only the medical consultations. Wow. Since the beginning of the war up to now, we provided 15 million, yes, and more than 15 million medical consultations. 10 million of them, they are conducted by doctors, and 5 million by them, they are conducted by nurses, by dentists, by physiotherapists, by providing other health services. You can imagine. So who are talking UNRWA is not available in Gaza. Look to this figure. Like this figure, like sometimes when I provide a briefing in the health cluster, some of you colleagues or partners, they were asking me to confirm this figure. Like, you are providing 12,000 consultations every day, or it is, yes, 12,000 consultations every day. And sometimes, and during some in period of times, we were providing 20,000 consultations every day, which make us providing these life-saving health services up to 15 million medical consultations to all of the Palestinians in Gaza, not only the Palestinian refugees. We included also the non-refugees in Gaza.
Yeah, and I know at one point recently, in the last couple of months, UNRWA was providing over 60%. So 60% of the patients who need medical consultations, whether refugees or non, UNRWA was providing those services. And now I understand it's about 40%. What are the main? Maybe you can tell us, Dr. Ghada, the main services that doctors provided both before October 7th and these atrocities and post. Tell us about the range and scope of services that UNRWA provides.
We provide the same services we provided before. Like, we didn't stop any of the services. Maybe some of the services, they were disrupted for a while, but return again to resume them after some disruption. But we were providing the primary healthcare services before 7th of October through 22 health centers or health facilities, including maternal and child healthcare services, non-communicable disease services, mental health, outpatients like surveillance of infectious diseases, physiotherapy, oral health services. And after the war, we provided all of these services, in addition also to new services like addressing the children with malnutrition. So we were doing a nutritional screening, what is called MWAC screening, MWAC measurement or screening, to the children between 6 months to 50 months. So this service was added during the war because of the needs. In addition also to trauma stabilization or emergency services to injured persons after their discharge from the hospitals, to make continuous follow up to them and we call it medical dressing to their wounds. For this nutritional services, we provided about 64% of the nutritional screening and management and support among Gaza. Like UNRWA provided the services to this nutritional services to more than 220,000 children among 340,000 children in Gaza. And this was life-saving because some of the children, they were dying from malnutrition. And also for the surveillance of infectious diseases, we provided more than 55% of the surveillance of infectious diseases in Gaza. Also, we provided the vaccinations to hundreds thousands of vaccination sessions to the children, in addition to participation in the polio campaign, because there was detected like a polio sample on some cases with acute flaccid paralysis, and detected the virus in Gaza. So we're participating in the polio campaign with the Ministry of Health and WHO and UNICEF, and we contributed to more than 35% in that campaign. In addition to that, UNRWA provided the WASH issues, clean water, and provided the tested water, either potable water and non-potable water, in addition to the sanitation services, which was really badly needed to the displaced persons, to more than 1 million displaced persons in UNRWA schools, which were like served as shelters. So, or not was, they are up to now, the displaced, they are available in UNRWA schools as shelters, because most of the houses, they were destructed in Gaza.
Yeah, and in terms of
addition to that, important service, which is mental health services. We were providing this mental health services and psychosocial support, and we did this mental health integration to all of our health centers, and we continue to provide these services. By the way, after the destruction of many of our health facilities or being inaccessible to us, now we have 7 health facilities. Some of them, few of them, they are from the pre-war permanent health facilities. Others, they are 4 of them, they are new established, like not in the same way of our health centers, but we established them temporarily in order to provide the services, in addition to 30 medical points with around more than 100 medical teams provided the essential health services all over Gaza Strip.
Yeah, and that's something I understood from the multiple displacements. You know, as you said, that some families were displaced over 2 years, up to 10, 12, even 15 times. They were carrying sometimes just the blanket they had, the clothes on their back, having to move and then move again. We've been saying like human pinballs in some sort of evil kind of game, being pushed around the Gaza Strip. And during that time, the structure of the health system, as you were mentioning, maybe you could tell us a little bit more, the structure of UNRWA's health system changed from what I believe, and I'm trying to remember from years ago, but some 27 centers to having, to moving to these mobile units, and then moving to where the populations were displaced. So tell us about what that change looked like on the ground.
Yani, it was not easy, or yani, this description is, I don't know, and this is not only difficult, it is like a miracle. It is like doing miracles. Like suddenly from having these wonderful, beautiful buildings in our health centers, very well equipped. And then when the first, like when there was displacement from Gaza in the 13th of October 2023, we lost nearly half of our health facilities in accessibility. Like they were available in Gaza and the north, but we were not able to reach them because they are in not secure area. And we lost all of our medical supplies, most of our medical supplies. But what is good, that we continue providing the services, which was like a miracle. Like, yeah, we don't have access to the health centers. The health centers destroyed. Okay, we have other health centers. We can establish another health centers. We can establish and turn directly to have like rapidly to have medical points. when the people the people moved, like when the people moved from Gaza to the middle area, we established medical bonds in the middle area. The people they are in UNRWA schools in the middle camps, we establish medical bonds in each UNRWA shelter. The people they moved to Mawasi area in the western, in the beach, in open area, we moved towards them despite they are not UNRWA schools and not UNRWA shelters, but we moved with the people and we established medical bonds there. We rented buildings at those areas in Mawasi area and established health centers there and tried to equip them. Some of those health centers, they were operating without electricity. But we used to have not only electricity and solar energy system and wonderful electronic systems. Our health staff, they were providing the services, and we were keen to register, to record, to report all of our work. And then these they were make photocopy on their mobiles and send to certain core team the photocopy in order to be registered in the electronic system. So we maintained and sustained the electronic digital system, which was like a pride of UNRWA. We sustained it despite of the very miserable situation. It was like doing miracles in Gaza. No one can imagine how they can register the names, the ID of the patients, take photo and send them to some colleagues who are in Cairo, and those colleagues are started to enter all of the data in the electronic system so we can know the child health records, the maternal health records, even we started to have the non-communicable disease records for the patients. So it was like really doing miracles. The doctors, the nurses, they were working in medical bonds in very, very bad situation. You cannot imagine, like tens, thousands of the people inside the shelter, and we like struggling to have the small area to establish this medical bond. But the doctor, they were providing these essential services to the sick children, to the sick mothers, to the sick elderly, and people like detecting infectious diseases, make like reporting and surveillance system of infectious diseases. We worked with WHO to establish another digitalized reporting of the infectious diseases, which called eWards Inbox. This is like digitalized platform used in emergency. And we expanded it to nutritional activities. We established this in nutritional activities maybe 2 months after the beginning of the war, and it was not easy to the staff because they didn't want to do mock screening. This is like we used to like measure the length or the height of the child and the weight with infant scale, and they didn't want to do that. Like, why? Like, are we in hunger or famine or what is happening? They cannot like understand or absorb the reality. But after that, we continued to do that to support those children, hungry children, malnutrition, providing the supplements supported from UNICEF to 100,000 of the children, saving their lives when their mothers, they come to UNRWA, trusting UNRWA nurses who know them well, and midwives, they know them by name. So they come to us by their children, sick children with malnourished, and when we like screen them, providing them with the support, with the nutritional supplements, of referring them to the hospital and continue calling them. This is amazing. This is amazing, despite of the huge struggling of the colleagues, of the patients, but it was like a miracle. We call it in Arabic astura. Yeah, this is UNRWA.
You and your staff, that you are miracle workers. working under the most extreme conditions, and again, facing all of the same conditions that the patients you were seeing, your staff were facing. When in 2022 in the summer, I was there visiting, you had spoken about the difficulty of accessing certain medications that, as you had mentioned, there's a 17-year blockade. You look now, and that time was an amazing, beautiful time in comparison to this horrific moment. But even then, as you said as well today, there was a blockade on all sorts of goods into Gaza. Gaza didn't control its air, land, and sea borders. And so you spoke about, I believe it was, tell me if I'm wrong, but I believe there were hypertension, diabetes medication, antidepressants, psychiatric medicine, and other shortages. Shortages is a euphemism. They were not allowed in. Tell me if that was in fact the case, if my memory is correct. And then what are the main medical needs and medical equipment needs that your team need right now? And I want to say, just as Americans are listening, that there are 6,000 the equivalent of food and shelter items and medical equipment that would fill 6,000 trucks that are sitting outside the border, that Israel actually will not allow into Gaza at this moment, when there are civilians facing such extreme conditions. So this is a travesty. This is just unbelievable. I want you to explain, Dr. Ghada, what are the key medicines, medical equipment that staff need right now to do their essential work?
Everything. Gaza lost everything and needs everything. And for us in health program, we lost everything and we need everything. As I mentioned to you, like we lost everything. What we have, which is the most important, we have the human beings, we have the staff, we have the people in Gaza, and the staff, they have the hope and the power to continue. But we lost since the beginning of the war. As I said to you, when there was displacement from Gaza City, we lost most of our medical supplies, and we were struggling for months with nearly like no medical supplies. But we were like having loans from WHO, from other partners, until we succeeded with like huge effort. From supported by Dr. Seita, supported by the Commissioner General, by the Deputy Commissioner General, the top management in UNRWA, to make those medical supplies entering Gaza. For sure, gradually and with huge effort with the health cluster to make our medical supplies a priority, because we are providing life-saving medical supplies like insulins, like hypertension medications and diabetic medications. Those patients will simply die, or pregnant mothers or children. So we succeeded to make some of the medical supplies entering Gaza, but all of the time of the war, we were suffering from shortage of medical supplies. This is not because we failed to procure the medical supplies. No, we have a lot of medical supplies. By the way, we have some of them now expired, while they are waiting in Egypt, and there is denial access to have these medical supplies inside Gaza. And this happened all of the time of the war. And also when there was like sudden order of evacuation from city to city, we have frequent losses of the medical supplies. Like when we lost them in Gaza, we lost again in Rafah, we lost it in looting of the medical supplies because of the mess and all of this situation in Gaza. So, but all of the time we were working with different partners, especially WHO, UNICEF, and other partners, in order to local partners or NGOs to support us in medical supplies, or with WHO to make our medical supplies entering Gaza. For time being, we have like zero stock of our medical supplies, about 48%, but we continue to find alternatives. Or to seek, like I would like from here to thank all of these like UN agencies like WHO and UNICEF, because they supported us by providing these medical supplies, because without medical supplies, really, believe me, like thousands of people, they will die, of patients, they will die. The people will not only die from bombing or being injured. No, they will die because they don't have the essential medications. That children who have like diabetes mellitus, they will die because there is no insulin. But we struggled all of the time of like not to have zero stock of any of these critical medications, and we succeeded to do that. But it was like struggling all of the time. Like it is not a luxury. It is like it is the right of those like children to have these medications. It is the right of that old patient to have his medications, basic and critical medication of hypertension and heart disease and diabetes mellitus. And for this who has fever, to have like something to decrease the temperature, for to decrease the pain, to treat the mental health conditions, to treat a child with convulsion. Some of the children, they have this convulsion until death. And I know that. I know some of them. Cancer patients who, I know some of them, they are from my friends. They died because of cancer patients. And one of them, they are our colleague. She died from breast cancer because there is no chemotherapy in Gaza and radiotherapy in Gaza. So this is the unfair situation. The patients suffer in Gaza, and also the staff, our staff, the health staff, the health management suffer because we feel like paralyzed because we are not able to make these medications. They are expired in Egypt, and we want just to let them inside Gaza to support those patients. Like that child can be my son, that patient can be like my husband or my father or my mother. Without these medications, it is very, very painful. And our health staff, they were suffering every day from these painful conditions when the patient like asking for the medication and they don't have the medications. They are trying to find alternatives, and our pharmacists, they are trying to look with WHO every day to find like alternatives to our medications which are stuck in Egypt. But again, we continue to provide the services with a lot of alternatives, and we never fed up from continuing doing that.
If I may ask, I mean, a little personal question, but how do you keep going? You have had so many, I hesitate to even ask, you've already described several people who you knew so well who have been killed, who have succumbed to their illnesses after bombing and starvation. What has kept you going? I've watched my own team, many of them Palestinians, many of them with family in Gaza, keep going, keep doing the essential work here, despite all the pain and anguish, trauma. How have you kept going? What has motivated you in a time that has by for sure is the most difficult 2 years you have experienced?
Maybe the most important thing which make us keep going is the belief of our humanitarian mission. When we see the suffering of the clients, of the patients, and in their eyes and the expression, the hope of UNRWA, like they trust us. And these issues which make us keep going, because we need to help those patients, those clients. We feel that if we are not able, or if we are exhausted and fed up, who will provide them with these critical services? Who will save their lives? Who will support that child who come to the medical point, suffer from malnutrition, severe acute malnutrition, and he will die maybe after days if we couldn't support him with the nutritional supplements, with medications, with doing the screening to support his mother, who will support that pregnant lady, and like in her journey during the pregnancy until delivery, who will support those patients with mental health conditions, and who will support all of these like patients in this unfair situation? We are the doctors, the nurses, the physiotherapists who are support the injured persons. This is the issue that we believe in our humanitarian mission, and this is UNRWA. Like UNRWA, it is not just a health program. It is not a program, only a program, or it is not only an organization. It is about humanity, and we work even not only but according to the mandate of UNRWA. No, it's also about the humanity. It's also about the trust of the people with UNRWA. We cannot make them like disappointed or leave them. They will be left for nothing. So this is the issue which keep us like going and trying to support others. And by the way, this make us or supply us with the strength. Maybe Dr. Seita, all of the time, he said that you are my heroes, the health staff in Gaza. And I always replied to him, yes, we are heroes, and I know that. But do you know, Dr. Seita, I fed up from being heroes. We fed up from being heroes. We just want to be normal persons like all of them. We don't want to be heroes. We just want to live normal life. And we don't want to be heroes anymore, because being heroes means that we live in this unfair situation and inhuman situation, and to fight all of the time in order to fix this situation.
Yeah, and just to be alive and carry on your lives and have some take care of your children and get them educated, the things that all of us want to do in our lifetimes, anywhere where we are, no matter where we're from. Yatikum el-afiyeh. Thank you so much, all of you, really heroes, angels on earth, doing the hardest work under the cruelest of conditions, most difficult of conditions. I imagine someday, Dr. Ghada, that I can meet you again in Gaza, in a rebuilt Gaza, where the population is thriving, and there's hope for the future, and there's so much brilliance in Gaza. I saw it myself, and I know it will be there again someday, inshallah. So thank you so much, and I'm honored to again be with you here today. And I just want to say, again, thank you for everything you and your staff are doing. And thanks to all of those who joined us today to spend this time learning directly from Dr. Ghada. She has so much to teach us. And I hope you have appreciated all of her comments today. If you remember anything from today's conversation, let it be this: that UNRWA is still in Gaza. UNRWA staff, some 11 to 12,000, are still providing life-saving, critical humanitarian care every day, despite the challenges they and their families are facing, just like any person trying to stay alive, trying to have a future in Gaza. UNRWA is still in Gaza, delivering healthcare, delivering education to more and more young people every day, despite losing their colleagues, their homes, and their loved ones. As we approach this year's end, there are 3 ways in which we ask all of you to try to support UNRWA's life-saving work. Of course, number 1, give generously if you're able to. Your year-end donation means that medicine, clean water, mental health support, shelter, and dignity can be facilitated in Gaza. We get the funds in, we send them, and we support all of this essential work. UNRWA is still the backbone of the humanitarian operation, despite all of those forces trying to stop this life-saving work. Continue to advocate. Tell the U.S. Congress that the U.S. government needs to restore funding to UNRWA immediately. Lives are depending on it. And amplify. Please share today's conversation with all those you know to counter misinformation. And really, unfortunately, it's become active disinformation about the work of UNRWA with the truth, with these direct testimonies from those who have lived this reality and are helping civilians live through this excruciating reality. We thank you for showing up for Palestine refugees and showing that Americans truly do care, and that Palestine refugees, Palestinians in Gaza, are not alone. Until next time, thank you for listening, and thank you most of all to Dr. Ghada for your selfless work, that of you and your colleagues, and my hope that that this ceasefire continues, that the killing, although the killing is still ongoing, that it stops, and that again we get to meet in a rebuilt Gaza someday, and it would be such a pleasure to meet you and your colleagues again at that time. Thank you so much.
Thank you, and we will be in UNRWA part of the recovery and rebuilding Gaza and restore the loss to humanity in Gaza. Thank you.
Thank you, dear. Thank you so much.